We observe a lot in the market, especially on the provider side, that there's a lot of false credits calls due to contract variances. And that could be just a mix of the way that the payer is repricing. It could be a mix of updated contracts that the providers are not posting, or just registration errors. It's a lot of manual work for false credit resolution because each user is going to have to adapt and review each of those accounts separately. It requires manual research. And then you cannot really identify the trends. So it really causes a drain on our resources versus focusing on things that are going to cause revenue or potential cash. So the best way to really deal with the false credits, especially when it's caused due to the contract variances, is first making sure that you're managing your payers' contracts. That's overarching a huge headache for providers because they're constantly changing. And sometimes a provider system could take 4 to 6 weeks before they even post. And in many cases, we've observed even longer. And so all that's doing is inflating their credits. So really coming up with some type of table or matrix of when do you expect those updates, capturing when is it aged out, so what are your outliers, and making sure that you're reconciling that in your system on a regular basis. So ideally, when you're identifying these contract variances and making sure that you're managing them closely on your updates, you would start with your VP level revenue cycle. What are you identifying? Where are your payers? Where is your largest population? And then working and partnering with your contract management teams. And specifically, that's broken out usually between your managed care, your blues, but get to those details. Those that have relationships, they should be able to give you exactly when's the next contract update, is it delayed, and what is it actually impacting. And then both of you should be working directly with your revenue cycle manager, director, to make sure that you're seeing that posted correctly as far as your contractual adjustments.